Hi, this is Dr. Paul Broman with Broman Chiropractic and Wellness. Today we're going to talk a little bit about sciatica. Sciatica is usually presenting, somebody's coming in and they're saying, I have pain or numbness, kind of starting in the back of the hip or buttock area, traveling down the back of my leg. And that's a fair, a fair report, and that's usually how the symptoms present. But usually, that's more of a description than it is a diagnosis. And in order to properly diagnose, we need to travel upstream. The nerves that travel and form the sciatic nerve, they extend from the lumbar spine and into that sacral spine. So involving the lower back and the tailbone, there's lots of nerve roots from this portion of the spine that descend and form this larger sciatic nerve. So it should be noted, the symptoms here are the result and not the cause. So if we want to properly treat this and effectively treat it, we really have to travel upstream and identify that root cause. And when we're looking at possibilities of what could cause that at the source up through here, there's a lot of different things. Some of the more common things that we'll find is if there's restricted mobility in the spine, we'll see a subluxation or a spinal misalignment where we need to remove that mechanical stressor. We'll also see sometimes that there's piriformis syndrome, where the piriformis muscle sits beneath the glute, the buttock muscle. And then a lot of people, the sciatic nerve pierces that muscle and passes through the piriformis. So if the piriformis is tight, it can compress that nerve and cause those symptoms. Tension and imbalance into the hips and the buttock muscle groups will also contribute to this. A couple other things, sometimes we'll see facet arthritis, disc herniations or disc bulges. Sometimes we'll see facet stenosis, where basically the narrowing, where that nerve root exit and comes to the rest of the body, that narrowing will get kind of narrowed off further and kind of choke off some of that nerve supply. So once we've properly diagnosed and what the upstream root cause is, then we can progress and effectively treat. It should be noted that a lot of times there will be multiple things. It's not just one cause, address that cause, and it resolves. So sometimes you have to do the full assessment and look at the whole picture. For an example, sometimes you'll have a restricted SI joint, that sacroiliac joint, where the tailbone meets the pelvis, and there's a lot of pain from those nerves that are passing through that area, but there might be imbalance with the muscle groups that's happened just from compensating. If you lean away from the side of pain, you can create imbalance in the muscle groups, and that's another contributor. So once we've properly diagnosed, then we can start to treat. And really the treatment is, there's two phases to treating this properly. And the first goal is to restore proper motion and eliminate pain and inflammation. So in a nutshell, what we're really honing in on in that first phase of treatment is to adjust and improve the mobility of the spine and the pelvis, and then do the proper stretches, muscle release techniques to get that inflammation under control. Once you have pain-free range of motion, then you have a good foundation where you can start to build, you can start to address stability and strength of the core muscles, the muscles of the hips, the lower back, the abdomen, and that helps a lot to prevent reoccurrence and stabilize so that you can do your normal day-to-day activities and not worry about this thing kind of flaring up and re-aggravating. It is important to know that it's very crucial to do these things in the right order. A lot of times people think, I'm going to strengthen my lower back and get this under control. But if you have a problem mechanically where you have a joint misalignment or a lack of mobility in a certain area and you try to strengthen, you've kind of done things in the wrong order and you can actually worsen or re-aggravate this condition. So it starts with establishing a good foundation with restoring pain-free range of motion, and then progressing to strength, stability work for the lower back and the core. Again, this is Dr. Paul Broman. Hopefully this was helpful. Thanks for watching.